Robotic spine surgery is anytime you have a piece of machinery in the operating room with me that is helping me accomplish a task. Classically, the spine robot has been utilized to help place hardware. And so we will get a CT scan before or during the surgery, and that CT scan, which is a fancy x-ray, will look at the bones, and we will decide on that CT scan exactly where we want to put screws or wires or implants into or around the bone. And then we tell the robot this is what we're going to do, and then the robot and I kind of simultaneously work to put those devices into the spine. Now, the beauty of the robot is that it is incredibly accurate. And so it's more accurate than just me by myself putting the screws in. It's more accurate than just me by myself with x-ray in the room. And so now I like to say there's the trifecta. So we have the surgeon looking at the patient, making sure that we're putting the implants where they need to go. Then we have intra-op x-ray, which we call fluoroscopy, making sure that the implants are going where they need to be. And then the third arm is we have the robot that is saying, yes, this is where the implant needs to go, and I agree with what the surgeon's saying, and the x-ray is saying, and the robot's saying. And so it's just this extra layer of safety that happens in my OR to help me accomplish the task of putting the implants in. Now, next-gen robots, which is where we're coming to now, are going to help decompress the spine. And so it's not just, hey, we're going to put a screw or a rod or a pin in this location. Now it's, hey, this is where I want to get the pressure off the nerve, and I'm going to use my visualization. I'm going to use the x-ray to tell me this is where I need to go. And then the robot is going to come in with its robotic arm and say, yes, this is the area we're going to decompress. This is where the neural elements are. This is where it's safe to decompress or take the pressure off the nerves. And so again, just an extra layer of safety that kind of goes into my OR. So that's robotic spine surgery, is having a piece of machinery that kind of helps me accomplish that task, and really is some redundancy and extra layers of safety with increased accuracy. And what that does is all of that adds up to better outcomes for the patients, faster surgical times, less dissection, which means the patient has a faster time to healing, less blood loss for the patient because the surgeries are faster, and more accurate surgeries. And so ultimately, all that little bundle kind of adds up to better outcomes for these patients.